we're seeing a lot of kind of primary infertility in men now as well. There's so many factors affecting sperm quality, sperm DNA. What are you seeing as the kind of common drivers of male-led infertility?
Yeah, I think this is a really important part of the discussion, because actually we know that infertility is 50% male factor, 50% female factor, but actually female infertility is normally where the conversation sits, and that's not fair. And that's why we have couples programs at HUM2N, and we have programs just for men as well, if they want to do something like sperm freezing or something like that. It's very similar to women, actually, I'd say. So stress is a massive one for men as well. And if you think about stress, it's a survival response. The body's going to be mobilizing resources, mobilizing blood flow to the parts of the body that need it the most. For example, it's going to be going to your senses, it's going to be going to your brain, it's going to be going to your muscles to help you move, but it's going to be directed away from the digestive tract, the reproductive tract, because you don't need to make a baby when you're running away from danger. So stress for men absolutely is always going to be a key one. Again, diet I think is really important, so making sure that they're really optimizing the diet. Again, you see quite a lot of the burden on optimization on the women here, so the woman's trying everything. She has tried all the supplements, you know, whether they're right or not, who knows, but really optimizing the diet, and sometimes the male partner could be a little bit more lax. And in a way, like, it's hard to blame them, because we've got less research on male fertility because it's always been seen as a female issue. So there's still a lot, you know, we need to find out about that. But I think we can overlay the science with some common sense. We know things like alcohol's not going to be great. We know things like smoking, vaping, marijuana, not great either. So we really want to clean up the diet, clean up the toxins 100%. And I think one thing we're seeing more of these days is actually low testosterone as well. So that plays a pretty big role in things like erectile function, even sex drive, but also just generally the optimal functioning of reproduction. So we really need to be thinking about all of that. And again, we've got more tools at our disposal at HUM2N to really test male fertility. So if you go to the GP, if you go to an IVF clinic, they might do quite a simple semen analysis, but we want to go beyond that, because we know that you can have a normal semen analysis and a very off DNA fragmentation. And if you've got high sperm DNA fragmentation, then it's going to be affecting your fertility. It can even increase miscarriage rates and pregnancy success outcomes and all of that. So we really want to be looking at this very holistically.